I was about to lose my business actually because I just wasn't getting any traction that first year, and somebody suggested I join a networking group because once I joined BNI, my business just took off. A couple of months later, I wasn't at risk of losing my business anymore.
Hey everybody, welcome to another episode of Connections That Matter, where we highlight Northern Colorado's best networkers and the connections they made that help their businesses be as successful as they are. And today I have Joe Andujo, a longtime friend, super networker in Northern Colorado on the show today. Joe, welcome to the show.
Thank you. It's a pleasure being here.
Awesome, Joe. Well, a lot of people know you if they've been networking, they've seen you at different events. I know you are all over the place, but tell us a little bit about your business and why networking has been such a prominent strategy of how you've been able to grow.
Sure. I just want to say before I start is that I wish I could be a fraction of the networker that you are because you connect a lot of people. So,
sure.
My name is Joe Andujo, and I'm a health insurance broker, and I help people eliminate their debt. And my background is in healthcare administration. I've been doing it since I was 17 years old. I enlisted in the Air Force out of high school, and I went into healthcare administration. So it's all I've ever done. I've always been on the other side of health insurance, though, verifying claims, submitting claims, verifying benefits, all that stuff. And so in 2018, after the Affordable Care Act was passed in 2010, I switched sides and decided to start helping people to bring down the cost of health insurance because it had gotten so out of control. It still is out of control.
Well, what was that process like from seeing what people were paying to switching sides and representing the other hat? Like, where did that decision unpack that a little bit?
Well, my last job, so when I retired from the Air Force, I went to work for Banner Health in Greeley, and my last job with Banner Health was as a senior practice manager in their gastroenterology practice across from the hospital in Greeley. And one thing that we noticed is our patients, when my staff would call them to verify their benefits, sometimes they would cancel because they couldn't afford the deductibles. And that put us in a bad place because, we already had them scheduled. We had to hurry up and try to get somebody in that slot. And that really kind of cemented it for me, that, something's got to change. And what was really sad was when Obamacare was signed into law, all these health insurance companies popped up, and I think there were like 28 in the state of Colorado alone. And the vast majority of them have gone bankrupt.
Sure.
And so, I guess a lot of people thought they were going to get filthy rich because now the government was compelling everybody to buy health insurance and finding them if they didn't have it. And that was not the case. They just it was just not a sustainable model, and most of the companies went bankrupt. A lot of the companies just left the state altogether because it's so difficult to do insurance here in the state of Colorado. So I actually left Banner Health to go to get a doctorate degree in healthcare administration, and I was about a year out from completing my doctorate degree when I decided I started looking to see what was out there for people with a doctorate degree in healthcare administration. And I came across this insurance company that did insurance differently. And I know that you had that plan at one time. And I really like the way they put their plan together to help bring down the cost of insurance and help to keep the out-of-pocket expenses to a minimum. And that kind of started my journey down this path. In 2023, I decided to run for U.S. Congress, and one of the things that I wanted to do was help people go to Congress to be able to bring down the cost of insurance and the cost of healthcare. I spent $124,000 of my own money. Ooh. And I didn't make it on the ballot. I came within 5 votes of making it on the ballot, but it was a great learning experience for me. And I really enjoy helping people when they think they have no other recourse, they can't afford health insurance. I really enjoy showing them that they can get affordable, quality health plans.
Well, I can relate, Joe. Like I remember we've always been self-employed, so 3 years in a row, like we'd get the notice letter that, hey, we're no longer continuing your coverage, open enrollment, please find something else. And then we'd find something else, and then they're gone. But there's no consistency, and it just turned into a process where nothing about that was fun, and it was just something that was a necessary thing to have to do. And then I think until I met you, where you got me on something consistent, but then also you were a consistent resource to answer questions as it came through. So how have you maintained your relationships with your clients as their needs are changing or they're using different companies?
Sure. So when I started selling health insurance, I was only doing private plans. And as I have evolved in my career, I took on helping people on the healthcare exchanges. I used to not sell health plans on the healthcare exchanges, and one year I calculated it. I did about $120,000 of business that I never got paid on, and I thought, wait a minute. Why am I, because I wanted to educate people and I couldn't, there's a lot of agents out there who if they can't help you, they say, sorry, can't help you, goodbye. They're just looking for that next person, the next commission. And I couldn't do that to people. After I saw what was happening in my clinic, people canceling a procedure because they couldn't afford the premiums, and some of these people, they needed to find out whether they had cancer or not, or, just needed to have a GI procedure done. And so for me, it's always been about educating people. It's always been about helping them get what they think they can't get. So, and now I do all plans on the exchanges, off the exchanges, private plans, plans for businesses. So just about anybody who needs health coverage, I can help.
What was that process deciding how to expand or add more products? And
so it started when somebody called me up and said, Joe, you want to go out to dinner? A friend of mine, and it was a friend of mine and a mutual friend of ours, invited me to dinner and said, we think you should run for Congress. And so at that point, I was a captive agent, which meant, I had certain amount of production that I had to do every month to keep my appointment with that company. And when I decided to run for Congress, I had to become a broker. And as a broker, you're not required to have any production every month because you're selling for a lot of different companies. And so that kind of hindsight being 2020, I probably should have become a broker sooner, but I was very comfortable in selling the products that I had, and I left the company not because I didn't like the company; it's because I was running for Congress, and but now I really enjoy being able to offer a lot more products and have a lot more solutions for people. So that's kind of where I evolved and opened. Kind of started thinking outside of the box and being able to help more people.
Yeah. Well, then as a veteran too, I know there's a big transition from retiring from the military to still having a full career and staying in your field. How do you feel like that's really prepared you for where you are now?
Perseverance, I think. I thoroughly enjoyed being in the Air Force. I wouldn't have retired except for the Air Force shipped me off to Georgia, and I didn't really want to go. And I missed Colorado, which is my home. And so as soon as I hit my 20 years, I said, okay, thank you, goodbye. I'm going home now. But it's just being present and being. So when I was in the Air Force, my last supervisor, she was a colonel, and she was a master networker, and she had contacts. She knew generals and colonels all over the world that were stationed all over the world. And that was one of the things that I really, as I progressed in my career, I never really sought out to become a networker. I'm one of those people that I work behind the scenes, and I get the job done, and I lead by example, but I don't. I'm not in it for the limelight. But she just knew people all over the world, and I thought, as I was getting ready to retire, wow, that is really, really nice. So I retired. I spent about 5 years with Banner, another 3 or so years working on my doctoral degree, but I still had not really done any networking at all. And it wasn't until I was about to lose my business, actually, because I just wasn't getting any traction that first year. And somebody suggested I join a networking group, and that's where we met.
Yep.
I showed up that morning. You said, "You're the insurance guy." I said, "Yep." Or health insurance guy. And I said, "Yep." He said, "You said we need you." And I don't know if you remember, but I signed up on the spot. That was a Thursday morning. Friday, you did the interview. And then the next Thursday, I was inducted.
Yeah.
So one thing that I learned is that has become very important in my career, because once I joined BNI, my business just took off. A couple of months later, I wasn't at risk of losing my business anymore, and I started networking more outside of BNI, outside the networking organization that we were in, and I remember, one of the requirements is, to bring visitors. And I always had a really hard time bringing visitors because it was like I was asking them to do me a favor. And then one day it just switched off, a switch went off in my head. And I thought, you know what, I'm doing these people a favor by bringing them and introducing them to a lot of business owners that could possibly do business with them. And so I started inviting people and telling them I was going to introduce them to somebody. Like if I had somebody who was a handyman, I said, well, you need to meet, my real estate agent. You need to meet, all the people in the group that we're going to be able to refer to them. And I became a little bit of a networker, not like you, but, and I really enjoy that.
Yeah. I
really enjoy connecting people. I enjoy being able to be a resource for people, not just on the insurance and the debt elimination side, but also, in whatever they need in their business to be able to, for them to be able to succeed as well. Because I know what that struggle is like, especially, my first year. I know that first year of being a business owner is really, really tough for some people.
Sure.
And in the insurance business, a lot of people don't make it past that first year. I was on the verge of not making it past that first year.
Well, and a lot of people wouldn't assume that networking is like a quick fix, like it's more of a long-term play. But if you needed it on a quick fix, what tips do you have somebody who maybe needs a little more urgent results from her networking than playing the long game, I guess, let's say that.
Do a lot of it.
Okay. Yeah. And I think there's a lot of people who go networking, but not at the frequency or the impact of you. So what does your typical calendar look like as far as networking events?
So I used to think that when you go to network, you go and you give out cards, and you pass out as many cards as you can. The secret, though, is when you go to a networking event, you listen. That's why God gave us 2 ears and 1 mouth. And I learned quickly because I kind of ran into a lot of people that all they wanted to do was push their business on me.
Yep.
And so what I learned was, and that's a little bit off-puttish. And I was like, was that me? Have I done that? So I had to stop and think a minute and then really reevaluate how I was networking. And when I go to networking events, I don't seek to meet a lot of people. For me, it's more the quality over quantity. And I think a lot of people who start networking, and I'm a bit of a recluse, believe it or not. I'm a homebody. When I go home, I don't like to be bothered. I don't want the phone ringing. I just want to veg and just do whatever I want to do.
Sure.
And stuff. But for me, it was just meeting the right people and then thinking, who do I know that this person could meet that's going to help them in their business? Mm-hmm. And that's what I always look for.
Yeah.
Whenever I meet somebody new, is I'm thinking, who do I know that's going to be able to be a good connection for them?
I think your follow-up is exceptional too, Joe. Like a lot of people come to my events, and then by the time I've called them and followed up with them, they're like, "Oh, and I already scheduled a one-to-one with Joe." And you're really on it. And I think I wouldn't have guessed that you just like being a homebody, because I just view you as a lover of people and a super connector. I think that's networking done wrong with some of these groups. There's like a lot of pressure to invite into the groups. And anytime people try to get someone to join their thing, it lands wrong. But I think what you highlighted that I just want to lift up, when you're able to make it a genuine connection, how powerful and helpful that is for all the parties involved. I always like to say, hey, connect the people you care about to meet the people you care about. And when you start making that web of connections, it really elevates you and your social status in front of those rooms. You also have been a part of groups, Joe, that there's a membership. You're building longer term relationships in addition to the ones that you're meeting and working in a room at a networking event. So does your strategy or your approach change if you are plugged into a specific group versus attending an event where there may be more people that you haven't met yet?
It really doesn't, because my goal is to connect people and to help people, and it doesn't matter whether I go to a networking event that's free, and there's a couple in the area that are completely free, or if there's some where if you're category specific, where you're gonna only so it's not too big. It's really it's pretty much the same. I just my goal is just to connect people and to help, whether it's in a small setting or in a bigger setting.
And then who have been some of your best referral partners, people that have helped you get out of those times where it was a little shaky to really lift you up, and then who are helping you thrive today?
I've met several people who are really, really good at connecting, and they have the same kind of heart that you and I have to help people and to connect people. It's like they thrive on it. More so than I do, I think sometimes. And so I've met a few people that they're very specific about wanting me to meet, or wanting to learn about me so that they can introduce me to other people. Genuinely want to know who's going to be a good referral partner for you. Who do you need to speak to, this week or next week?
Yeah, and who generally, we like to have people make connections that matter, and there might be people watching the show that want to do a follow-up or do a one-to-one with you. So what industries or professions are you looking to connect with?
So right now I'm looking for the small business owner between 1 and 15 employees. That's 1-5 employees that think they can't afford insurance for their employees. I have some great plans that are very inexpensive. And when I show them how inexpensive it is, they usually say, "Oh, I can afford to pay all of that." And so that's what I'm looking on the insurance side, kind of really focusing on that. On the debt elimination side, I don't know if you know this or not, but the number one reason that couples divorce is due to money problems. The number one reason for men committing suicide is money issues or debt issues. And so I'm looking for clergy. I'm looking for people who are able to, who are counseling these kind of people. Couples and men in crisis, because I know that I can help them with our debt elimination programs. And those are the people that I'm really concentrating on. I tell people I'm on a mission to save marriages and lives, and I really truly mean that.
Yeah. Well, and entrepreneurs, they're risk takers. They go all in. Yeah. It's not necessarily the easiest path all the time. And why we like to share all the success stories, sometimes there's the losses that you talk about, or being able to ask for some help when you're down, and the learning experience that you have. Joe, I mean, I'm just inspired by you to truly, with what you believe in, to put up over 6 figures of your own money to run for Congress. But Where does that come from? That level of like, you know what, I'm all in. I'm ready to do something big, and I'm ready to truly put my money where my mouth is and go from there. Unpack that when you're like, yes, I am going to run for Congress. I am going to put myself out there.
Well, when I was originally approached about running for Congress, I laughed and I told my friends they were crazy for even thinking that I'd even want to consider that. But they made a compelling case because they knew me, they knew what I stand for, and so it took me a little while, of kind of hashing it out and thinking, well, maybe this is something that I can really help. But I just like to help people. If I can help somebody who's in need, or if I can provide a service for people. When I was younger, I had considered going into medicine, but I'm not very good at science. I suck at math, so and chemistry and all that stuff. So I knew that wasn't going to be in the cards for me, because I just was not going to put the effort where I would have to learn to be able to overcome my inability to do math well and chemistry well and biology, crying out loud. So I thought, the next best thing is to work alongside those professionals who provide those services, the medical professionals. And so that's what I did since I was basically 17, is I just enjoyed working at hospitals and clinics. And I have a deep admiration and reverence for, anybody, doctors, nurses, phlebotomists, anybody who works in the medical field, because they're helping people every day. And I was glad that for many, many years I was right alongside them, on the administrative side, helping them complete their mission. So.
Yeah. Well, Joe, I'm sure there's going to be a lot of people watch this episode that they want to connect with somebody that is a genuine connector. Like, they don't want to go on another one-to-one where it's that person like handing and pushing their business card, but someone like you where you're going to really be a listener first, where you're going to find resources for what they need. So how can people get a hold of you if they want maybe you to look at their policies, or if they want to set up a one-to-one with you?
Sure. Well, thank you for that, Andrew. My telephone number is 970-237-4740. You can also reach me at integrityhealthco.com.
Awesome. Well, Joe, thank you so much for coming on the show, for being a leader of networking the right way within my community, and just being a positive force in Northern Colorado. I really appreciate for what you do and sharing your insights today.
Well, and thank you, Andrew, for doing what you do, because you are a master networker. And I just, like I said, I admire what you do and what you've been able to do in Northern Colorado to bring so many of us together to be able to network and to help each other. So thank you for that.
All right. Well, we'll see you around Northern Colorado. Hey all, thanks for watching. I love networking and building relationships with other Northern Colorado business leaders. So if you want to come meet some of these podcast guests, meet me, or meet some other amazing entrepreneurs in Northern Colorado, I would love to have you attend one of our next events. Go in the podcast description. There's a ways that you can see our upcoming schedule, and maybe you could be a future podcast guest as well. Thanks.